So what I will do today is basically give you a background of how we have provided the leadership of what we are going to use the money that you have provided to us and what we have accomplished and where we're going. And today's meeting is really very nice because it is collaboration with the Center for Pancreatic Disease here at UCLA, and all the speakers that you're going to hear today, plus the patient panel, are all from UCLA. But when we started this meeting about 10 years ago, there is a combined scientific meeting and the patient family support meeting joined together in this room. As you could see today, we are now exceeding 150 people in this room. So it will be very difficult to have both the scientific meeting to be joined with us. Now, the scientific meeting had migrated to the American Pancreatic Association annual meeting. And we celebrated the 10th anniversary of the seed grant program that Agi Hirshberg Foundation have provided us, that supported right now over 30 institutions throughout the world, including in Israel, Japan, and in Europe. There were over 400 participants to the meeting from 20 countries, and through your generosity over the last 10 years, you have provided $5 million to support the research program of the Hirshberg Foundation. Of that, the awardee with their seed program have developed grant application that have now exceeded over 40 million funding from NIH and other agencies. As you can see from the list that Agi have shown you, institutions from the East, Harvard, Columbia, Mayo, to the East over here to San Diego, San Francisco, all the key institutions have received seed grant from Agi Hirshberg Foundation. Now, the proceeding of that, thanks to Jim, where's Jim, have videotaped the whole proceeding, and you can look at the whole proceeding at the website of the Hirshberg Foundation. And there is also a pamphlet, a newsletter in the table if you want to take it. And the scientific accomplishment of the Hirshberg Foundation seed grant will be published in the Pancreas, and it will be distributed electronically to over 110 countries. And that will appear on March issue of this year, which is next year, or which is this year. Now, one of the things that Agi did not mention to you, that during the annual meeting of the American Pancreatic Association, Agi has been recognized by the American Pancreatic Association to receive the Distinguished Service Award, recognizing her vision, leadership, stewardship on pancreatic cancer research. This is really an addition of her recognition by the Cancer Care Incorporated annual meeting in New York in 2011, for which she had received the recognition from the Cancer Care Group. So it was really a very nice celebration, and you can see this in the videotape in the foundation website. Now, when Agi approached me in, as you said, 1998, 1999, and the National Cancer Institute in 2001, I was part of the strategic planning process at the Washington, D.C. And they asked me if I would draw a slide of where we are in pancreatic cancer and what is the clinical things at the time in 2001. This is where we were at that time. The disease is basically focused on the treatment side, and by the time you have symptoms, the tumor have become too big, and it's already metastasized. And if you are been diagnosed, the only capability we have is basically surgical because chemotherapy was not there yet. But what came out on that meeting and the strategic planning, we start recognizing that the disease is not really started when you have symptoms. The disease actually started 10, 15 years beforehand, and there's an early stage of development for pancreatic carcinogenesis. And it was also recognized at that time that inflammation was a very, very key component. At that time, we were thinking that perhaps therapeutic and prevention on the early stage will be a major goal, which we have not accomplished until now. Now, where we have been the last 10 years and where the field have moved and where the support through your generosity and where the federal agenda has done. First, we have now identified a high-risk individual that can be screened. Many of them are genetic, and some of the high-risk group is basically smoking. Another high-risk group is aging. If I'm 40 years old and grow up to become 80 years old, my risk of developing pancreatic cancer is 100-fold. So aging is one of the major problems. Pancreatitis, diabetes, all of these now are part of the high-risk individual. We have now improved our imaging modalities. CT scan, MRI, ERCP, ultrasonic endoscopy. So we have improved our diagnostic capability. We have increased, thanks to the surgeon, if you have the disease localized and resectable, depending upon which center you went into, the 5-year survival is really very good. It has increased from the 4% at the time in 2001 to 25 to 35% survival 5 years if your tumor could be resected. And about 1/5 of the patient with pancreatic cancer can now be operated. When I entered the field in 1960s, I have never seen it, although I was at the Mayo Clinic. We don't have a resectable tumor for pancreatic cancer. So quite an improvement. And now we are now talking about targeting therapy. I don't know if Chuck Bronacardi is here. He's one of the pioneers in that area, talking about personal targeted therapy for pancreatic cancer. We are beginning to talk about prevention from the workshop that we have organized at NCI last June to talk about how can we screen and start thinking about preventive approach. So this is where we are. Now the sad part to the field is that pancreatic cancer right now, mortality, we are ranked number 4. But in 10 years' time, we will go to rank number 2 behind lung cancer. The incidence and the mortality rate continue to grow. Other disease, colon cancer, breast cancer, prostate cancer are declining. Pancreatic cancer is increasing. We have no handle to it. It's the shortest survival we got. So that's where we are right now. Really sad. With that message, we try to convince, and I have part in lobbying our Congress to give us more money. I'm being formerly a federal agent at the NIH. And the sad part about the support is not quite there. You see, in 2003, when Agi told me, Bill, you cannot retire, we need to start thinking about it, we got a $42 million support from pancreatic research in 2003. That's less than 1% of the total budget of NCI, of the $4+ billion they have. Now, the people say, well, it's nice, you have grown to 2,000. In 2012, you have now all double that amount. But we have not really got our fair share of the federal dollar. Less than 1% to 2% in 2012. 2013, you know what happened? It was sequestration, you have heard about it. We lose 6% of that $100 million we got. 2014, we're going to lose another 3%. So we're going backward instead of moving forward. And the NIH, NCI have not even put the 2013, 2014 data in there, because that tip in there, we're going to go back less than 2%. So we have our things to do with our federal government to see our fair share. We're not there. Lung cancer has about 8 times to 10 times support. Breast cancer had 4 times support than what we got. So we have things to do. So Agi Hirshberg, during our celebration on the scientific meeting in Miami, have recharged the scientific committee to tell us that she will going to raise another $5 million for us over the next 10 years, and whether we can start targeting of how to spend the money to help to move forward to where we're going. And these are the people who are helping us, and Howard Reber is member of that committee. Lee Rosen is member of the committee who will be speaking to you today. So my message to you is really to express our gratitude. We cannot do our science, we cannot improve our clinical practice, we cannot improve our clinical management, we cannot improve any of what we are doing in the conquer and fighting pancreatic cancer without your help. We are really very grateful to you and your dedication to contribute to what we are doing with the Hirshberg Foundation. And I'm very, very pleased to see that many of you stay connected, family, patient, and other support area. Now, my last slide is going to show you is that only 4 days ago, we celebrated the World Cancer Day, for which we participated. And you probably heard and see in the newspaper, and I was in the conference, it's really, really sad. Pancreatic cancer is growing very fast outside from the United States. They're expecting we're going to double it in another 5 years. We'll quadruple it in another 10 years. And the reason behind is that the outside world have adopted our lifestyle. Smoking, drinking, obesity, diabetes. So we're losing our fight globally. So there is an action plan internationally to see what we can do to turn the clock back. And I basically told them, we still have our fight here in the United States. We're going to move into number 2 cancer mortality in 10 years. And I don't know how we can solve the problem without the support that you have provided us. So with that, it's really good news that we have accomplished a lot, but the fight is not over. Thank you for all your help and your dedication, and for joining us in trying to see if we can conquer pancreatic cancer.